Welcome back to the Empowered Athlete Podcast. It's your host, Natty Boss. And today we have a special guest, Miss Melissa Biscardi. She is going to speak to us today about all things concussion recovery, which is really prevalent in our sport, unfortunately, as well as just brain health. And she's an expert in these areas. So I'm really excited to have her on here today. A little bit about Melissa. She's a registered nurse, an osteopathic therapist who focuses on concussion rehabilitation, long COVID, and brain optimization as well. She's a private practice in Toronto, Canada, and virtually she works with busy go-getters aiming to reclaim their brain health. She also acts as a mentor to clinicians, teaching workshops, and through her concussion mentorship program and workshops that she hosts. She focuses on, as I mentioned, brain rehabilitation from a functional perspective. That is getting things working better without the use of medication. So going back to that holistic concept that I teach and preach about, which is why we're having her on here, because our philosophies very much align. And that's why we're bringing her on. And she's massively passionate about providing patients with effective, evidence-based, and personalized care, which is something that I appreciate as well. And she's published numerous research articles and 3 book chapters covering different aspects of brain health, including concussion, dementia, injury prevention, and aging with brain injury. Super cool. She's completed a Master of Science focusing on women's hormones post-concussion, and she's currently pursuing her PhD at the University of Toronto, focusing on interventions for adults with concussions. She also is a host of the Brainiac podcast, and make sure you give that one a listen, and I'll make sure I put that in the show notes with her other information to reach out to her. So welcome, Melissa, to the show.
Thank you so much. Wow, that was really interesting hearing about myself.
Yes, right? That's
But
amazing.
thank you so
Well,
much
you
for having
deserve
me.
it. I mean, you have all the accolades and accomplishments, and you've put all the work in, so you deserve to be celebrated.
Thank you very much.
So I'd love to open up the conversation for those who haven't heard of you, just a little bit about kind of what got you into the profession of where you are now. And was this something that you always wanted to pursue, or was it something that organically developed, just in your pursuit of your studies?
Yeah, it's pretty interesting because it definitely hasn't been a linear path. And I started in nursing as a nurse, which actually came after an attempt at studying computer programming. So I went, which I forgot about. It's deep in my memory. So I started computer programming. It wasn't really a fit, mostly because of the calculus, but something that still resonates is what I liked about the programming was solving the puzzle, right? Then I took a break and my dad said, well, what would you do if you didn't need any money? And I had always, I was born a healer, I would say. I've always had this empathy, this love of helping people. And so that led me into nursing. And upon graduating from nursing, I worked in reproductive medicine. So, with patients who are having issues with fertility. So I'm in Canada, and while we have healthcare that is covered by the government, fertility more often than not is not. So it was very business, which didn't resonate with me for too long. And then I met an osteopath who I thought was like the coolest guy on the planet, wanted to be just like him. And it just percolated for a little while. And then I said to him, what do you think about me kind of changing directions? And he was very supportive and ended up becoming my mentor. So that got me into osteopathy. That's when I met him through jiu-jitsu, through competing. He used to come in and treat the athletes. And then he already planted the seed about an interest in brain health. And then organically, I also developed an interest in brain health through my own little, maybe we can get into it later, but my own little brain struggles, which I had to essentially find my own way. So it was this invisible injury, especially being a female, never mind a female healthcare provider. So I knew how to get through the system, and I was still sort of, oh, it's stress, it's nothing, you're imagining it. So that got me really interested in like the invisible injury and brain health. And yeah, and then here I am, essentially.
I love that you're kind of alluding to brain injury as an invisible injury, because it's not something that we see, and we often we take that for granted if it's something that's not in our immediate reality, like a broken arm or, a torn shoulder. We don't think of it, but I mean, our brain influences so much. So I love that term, that invisible injury. Yeah, that's really cool. Well, I'm so happy that you're here. And
Thank
what a
you.
wild journey it's been. And the universe always aligns things perfectly to get you to where you are today.
Absolutely. We can only understand it looking back, right?
Absolutely, 100%. So I'd love to start off with really basic kind of information for those who might not know. But like, what is a concussion? Like from a scientific standpoint, what's a concussion? And, what are the risks of concussion?
Yeah, absolutely. So a concussion happens when we get a force that is applied either to the body, the neck, or the head that causes the brain to shake inside the skull, essentially. So it shakes, it disrupts the function of the brain. We call it a functional injury because things are not working quite as well. But if you get an MRI, it's going to be clear. Right? It's not a brain bleed. It's not a tumor. So that's an important piece of information. If you get a concussion and you go to the ER and it's clear, that's how you want it, essentially, right? You don't want anything showing up on imaging, but you're not going to feel well. And the reason is because just like when you hit your elbow, there's this inflammatory process that takes, days, weeks, depending how bad the injury is. The same thing, or not the exact same, but something similar is going on inside the brain. There's this whole, we call it a metabolic cascade, and there are different parts to it. The first part is why you see stars, right? There's just a huge release of chemicals, and then there are various parts to it over around 6 weeks. So even if you're feeling better within a week, you're still not better, essentially, under the hood, right? There's not an efficient production of energy happening. And also you're using energy at a huge rate because your body is trying to restore itself, essentially.
Yeah.
But one thing that's important to know is you need a certain amount of force to sustain a concussion. So for whiplash, for example, you need 8 or 10 G's of force. And comparably for a concussion, you need over 80. So there's always whiplash in a concussion, essentially, and you're more likely to get whiplash than a concussion. And it gets a little bit muddy because a lot of the symptoms of whiplash are concussion, but usually we treat as a concussion regardless. It's like, be conservative in your approach.
Yeah, 100%.
Yeah, so that's a long-winded answer, but
Yeah, no, that's really, really helpful to understand and just like know. I think the force is a really big indicator too. So like
absolutely.
working with, say, clients or athletes, like, do you just generally, is it part of the like assessment process where you ask them like kind of what happened, and then that kind of gives you an idea of what it might be around, or is it more symptom related?
Definitely take a history. And yes, sports related concussion. Sports is the number one cause for like kids and young adults. But then as we get into older adulthood, and I mean like over 30, not aged, but like after you get out of that young adulthood, it's motor vehicle accidents, falls, like all these other ways that you hit your head, essentially. So we want to figure out, okay, what exactly happened and how much force was involved. Like if it's a motor vehicle accident, usually there's a whole bunch of things going on, right? Just because that's so much force.
Yeah.
Or were you, wrestling and someone took you down in a way you weren't expecting it, and then you hit your head.
Yeah.
So figuring out what happened. Some people also just like getting up and not paying attention and hitting their head on a cupboard or something that's open. So we have to say, okay, how much force was involved? And then if someone has already sustained a concussion in the past or within recent months, sometimes it's not a fresh concussion. If it's a small hit, it's just like, we call it a setback or a flare of symptoms. I've had a bunch of patients this winter, because we have snow where I am, where like snow would fall on their head and they would get a huge resurgence of symptoms, but it wasn't enough to cause a concussion. But the body's reaction was, oh my God, this is happening again. So we cannot undermine the importance of the holistic, like mindfulness, because your brain will turn on symptoms in an instant when it is afraid, right?
Yeah.
Like fight or flight essentially can generate probably 90% of the symptoms of concussion.
Yeah. Wow, that's really interesting to know. One of the things you had mentioned before, which I was just curious about, and it makes perfect sense, because with any injury, our body's going to utilize the energy that we have to start that healing process. So from like a nutritional standpoint or like a calorie standpoint, is there any protocols in regard to nutrition of like, whether it's just like eat what you're normally eating, whether it's, changing up the way that you're eating, or is it increasing your calories, knowing that you're going to be doing that, although maybe depending on the injury, they might be decreased in activity. So like all of those different factors.
Yeah, it's interesting. There's no like quote unquote concussion diet. We know certain things that don't work. For example, the regular diet, right? Of like pasta and IHOP or whatever it's called. So we know that's not great. There is some evidence for the keto diet for other neurological conditions. So some practitioners will say, if you can do keto in the early stages. But what's most important is, like, I make everyone cut out gluten as best they can. That's usually a game changer. No gluten, no dairy, like decrease on the inflammatory stuff, definitely no alcohol, and eat like good quality food, but for sure, everything, I would say fats, proteins, and then for carbs, the vegetables and fruits, probably how most of your listeners are eating already, which is good, hopefully. But then
it sounds like just a healthy lifestyle.
Right. And then thinking about, okay, supplement wise, there is some research on creatine in the early stages, improving recovery, especially when it comes to the mood stuff. We usually recommend high dose fish oils. I think there actually is some new research on this, like high dose omegas. Magnesium can be good, especially, well, a lot of people are deficient in it anyway, but if you're having trouble sleeping after a concussion, which often happens, and then if you're not sleeping, you feel like crap. So it's like this cycle. So sometimes we will recommend magnesium. And then depending on the practitioner, especially if you do see a naturopath, they will have little things that they'll tweak for sure. But I would say, just like healthy diet, water for sure, creatine, magnesium, omegas are probably the big ones.
Nice. Awesome. And I don't know if there's any specific like risk factors, but I'm curious. I know that we had a conversation a while ago, and I believe I remember that women have a greater risk than men for getting concussions. But in addition to that, and expanding on that, are there any other like risk factors?
Yeah, absolutely.
Like that, or pre-metabolic conditions or something.
So definitely being a woman. So the change happens after puberty. So it's definitely hormone related, like as kids and older adults, the risk is basically the same. But once women hit puberty, their risk of concussion overall is higher. And then their risk of post-concussion syndrome or persistent symptoms, which is essentially when your recovery takes a long time, is increased in the luteal phase of their cycle. And I think we talked about this before, where, and I know you do this in your program, like cycle syncing, I think it's called, or right. And so that could be, I don't think there's a lot of cycle syncing happening as a preventative for concussion, but where it could be helpful is return to play. So making sure you're not returning to play in that luteal phase when you're going to be at a risk for maybe getting another concussion. So that knowledge is really helpful. Then any sort of mood disorders, that is a risk factor for poor recovery. So if you already suffer from depression, anxiety, ADHD, migraines.
What about bipolar?
Oh yeah, absolutely.
Yeah.
Absolutely. And I can say it, ADHD, migraines. If you have any other hormone issues like hypothyroidism, but I usually say, like, if you have any health issues, it's probably going to affect your either risk or recovery, because your brain is already working hard just to maintain homeostasis, right? So then you get this trauma thrown in, it's not necessarily great. And we can never prevent concussions 100%, but just like knowing and then making some choices, empowering, right?
Yes, 100%. And so I love that. And in regard to identifying the symptoms of concussion, you mentioned a couple, like maybe irritable sleep or not, or maybe some mood swings, but what are some of the most common symptoms that one can expect and to look out for, especially because you said the concussion phase could last up to 6 weeks.
Yeah.
So like, are there any that are delayed symptoms as well as like immediate symptoms, or is it just kind of like it's different for everyone?
Yes, definitely. Like right away, it's usually that dazed, confused, can get a headache, sometimes vomiting within, let's say, the first 6 hours. In and of itself, the vomiting isn't necessarily, to ring the alarm, but if it's projectile vomiting, it's like immediately you should go to the ER.
Okay.
Blurred vision. And then persisting over time, then you will get for sure headaches are super common. You can have different visual disturbances, whether it's eye pain or just eye fatigue. Screen sensitivity is usually early on, or light sensitivity. And that one usually lingers for quite a while. It's a hard one to treat and manage.
It's on their phone and on their computer.
Exactly, right? And some people will get nausea, dizziness, sleep disturbances, and that one is vicious cycle, right? Because you need the sleep to recover. Irritability, what else? Brain fog for sure, and just like quote unquote not feeling like yourself.
Yeah.
I'd say those are probably the most common ones. So it's definitely a cornucopia, and some people will have all the symptoms and some people will just have one or two. Like it really depends.
Do you recommend, if somebody feels in their own like perspective that they may have hit their head in some type of blunt force way? For instance, I literally hit my head on the microwave constantly, but I know that I didn't necessarily get a concussion because of just like you said, that level of force. But say someone does something where there's that blurred line, they're not quite sure, maybe it's in training or something like that. Do you recommend people like go to an ER right away, or kind of manage some symptoms and just keep a personal record for a few days? And if they're not like getting better, then go seek a professional, because in the US, at least, our healthcare isn't free.
Right.
So like that definitely plays a role in people wanting to take that extra step.
Access care, right? So I would say definitely, actually I'm gonna put something out. Definitely right at the time of injury, you will want to look out for the red flags. And in this case, you would want to go right to the ER. So if you lose consciousness, you actually should go to the ER, but only in 10% of concussions will you actually have a loss of consciousness. So it's way less than you think. If you're having, like, I feel like these are obvious, but we're going to go over them anyway. So if you have seizures or convulsions, worsening headache, definitely, like I said, projectile vomiting, increasing confusion. Oh yeah, if there's any bleeding involved, you'll want to go to the ER. Slurred speech, or if you're getting like weakness in your arms or your legs, those, it's like, okay, we can't even wait. We're going to go get checked out.
Yeah.
Okay. Otherwise, you still should circle around with someone, but maybe it's not as urgent. Yeah. And then especially, hopefully, if you are, on a sports team or part of a martial arts gym, you'll have access to someone who at least maybe you can message and be like, what do you think about this? I mean, a healthcare provider, not just a teammate.
Yeah.
Right. And then nowadays, though, there are so many people who are available virtually. So
Yeah.
even if you're in the States, you might be able to access a practitioner that, yes, it will have a cost, but like very minimal as compared to going into the hospital.
Yeah, exactly.
And then in that first 24, 48 hours, we used to say, lock yourself in a room. Well, thankfully, I never said this, but, lock yourself in a dark room until you feel better. But now we know that recovery is much more active. And, we definitely want people to rest over the first couple of days, but then we're making decisions around return to low level of activity. Yeah, essentially.
Yeah, and that kind of leads me to my next point, which was common myths around concussions and concussion recovery. And you kind of alluded to one of them being like, lock yourself in a room and just rest in perpetuity.
Right.
Like, what is the recent research and the newest research saying as far as the recovery protocols for concussion? And what are the myths that you can bust for us?
So the myth, definitely the big one. And it boggles my mind that people still get this advice because the research is so far into, like, there are very few things that we can say with certainty in science, but this research is like as close to certainty as you can get. And that is, there's been many studies, and also a meta-analysis, which is where you like take all the studies and combine the results. And then they compared all those results to rest, essentially. And what we know is early intervention is associated with a better outcome. And so that can look like at about 48 hours, better to be guided by a practitioner because we measure your heart rate, your rate of perceived exertion, but essentially we're starting you slowly on aerobic exercise for blood flow circulation, right? Helping with drainage pretty early on, and then slowly increasing this over time. And that's at 48 hours, we can, in most cases, like depends if it's a motor vehicle accident, maybe not, but early, right, compared to what we used to say. So 48 hours, we're looking at activity, and actually rest is detrimental. Like that's what the evidence says. So you definitely want to be seeking out some sort of guidance. We don't want you training at 48 hours, but we don't want you in a dark room. So that is
find
like
that balance,
right? So that is the really big myth that has to be busted across the nation. And then
and in regards to rest, to kind of add to that, as far as a myth, I know that one thing that like was in my sphere for a long time, as far as what I believed was helpful, was like, what about sleep? I know rest,
yes,
not necessarily sleep, but a lot of people, there's either like sleep it off or don't sleep at all, don't even blink, or you might never wake up.
Yes. Oh, that's such a good question. So we used to say wake someone up every hour or something crazy like that, but you can wake anyone up every hour and they're going to feel like crap the next day. Like they're going to feel like they have a concussion, right? So you don't need to wake people up every hour. They can go to sleep. You want to check in on them though, right? Just make sure they're okay, but no waking up. You can go to sleep. Usually we'll say sleep at night, right? Like sleep at night because you don't want to disrupt your circadian rhythm. But if you have to take naps in the afternoon, especially in the early stages where there's this huge metabolic crisis, essentially, definitely rest is okay. And then when you're awake, you can be walking around, doing light things that don't trigger your symptoms too much. In terms of phone use, the evidence says like less than an hour a day in the early stages. So we used to say don't use it at all, but now it says apparently you can use it a little bit, but for some people it's so triggering.
Oh wow, interesting.
So, yeah.
You think it has to do specifically with like blue light?
So there are a bunch of different like filters you can use to help it a little bit. It's the flicker that's the issue though. So
Okay.
in the phone, it's the flicker rate is different than on a laptop. And then you can get flicker free monitors, which I think if you're working in an office job, you should just have, because otherwise it's like a strobe light,
Yeah.
8 hours a day,
Yeah.
just right into your brain, essentially. But then you can download different, like there's one, I believe you would call it an app. It's called F-Lux and it's free. And that lets you dim the settings on your laptop quite well. And then I usually recommend people put dark mode on their phone. I mean, those are just strategies, but just to
Yeah.
help people get by, essentially,
Yeah. Yeah.
that can be helpful. Um,
Awesome.
and then yeah, another myth, which I kind of alluded to, is that you have to lose consciousness to sustain a concussion, which is like totally untrue. Yes, because only 10% or so of people who get a concussion actually lose consciousness. So it's,
Wow. Okay.
yeah,
So it might be, are concussions potentially more prevalent than most people might think because of that?
I think so. Or I would say it used to be that way. Now that there's so much, at least it seems in Canada, but I'm assuming in the States too, so much awareness around concussion. Like it's
Yeah.
all over the news, all over Instagram. So people are more alert, essentially, or tuned in that, oh, I might have sustained a concussion. And I don't know if it's to a detriment. Like we have to create a fine balance, because I feel like for some people it's almost, what's it called, self-fulfilling prophecy,
Yeah.
right? Because you will have a small hit that probably wasn't enough force to sustain a concussion, but then that stress response has just driven your
Yeah.
brain and body into fight or flight.
100%. Yeah. Definitely makes it worse than it is.
Absolutely.
Like
And
yourself.
actually,
Yeah.
an interesting thing that, and I was surprised because it came from a physician and they're not always like mindfulness
Yeah.
based, but this one was saying right now, after like all the craziness of the last 3 years, that we should be doing 10 times as much for our mindfulness and our nervous system than we were before. Which
Wow.
I thought was like, I don't
Good
know, that's pretty
job.
profound, because it just shows, wow, it's even more than I thought that we're needing to do to like nurture that calm, essentially. And
Yeah.
all healing happens in the calm, right? You can't heal where you're like running around like, oh my God, I'm late. I have this to do.
Absolutely. And that kind of leads me to one little aside to insert about like breath work. Has that ever been something that you integrate with your clients?
Yes, absolutely. I do it to a, what would you say? Like to different degrees, depending where the person is coming from, because some people haven't taken a proper breath since 1982. So for them, we have to start small. And
Yeah.
usually I start with, okay, I just need you to do 4 breaths where you elongate on the exhale. And then with other people, they're more, on board and ready to go. And then we'll do more of it. But there actually was a recent study that showed early exercise plus breath work is associated with even better results in terms of concussion recovery. And I mean, also that's brain health. Concussion recovery is brain health. Like they're basically the same thing, right? Move your body, eat well, do some breath work.
Right. That's like basically all it comes down to.
Right.
I would love that study. If you have access to that, if
Yes,
you're able to like send it
I'll
to me,
send
I
it.
would love that. And I could put it in the show notes for anyone interested in the scientific details, but that's definitely something that interests me. So
Yes.
the combination of those things and seeing
And
those
it's pretty
tangibility.
logical too, but I find that it's so funny because it's logical to me, and I'm sure it's logical to you, but we
Yeah,
still, people doubt it until it's written in a paper, and it drives
exactly. Yeah.
boggles my mind.
Yes, I know. Oh, I know. So you had mentioned brain health and concussion recovery kind of being one and the same. So I'd love for you to speak a little bit to like the chronic concussions and maximizing brain health after a life of having
Yeah.
multiple injuries and just brain health in general.
Yeah, so definitely, especially athletes, and sometimes workplace injuries, you can have like multiple injuries over many years. And then especially how we approach them has changed. So maybe they were ignored for all those years, but there's still potential for healing, right? Like our brain, our bodies were designed to heal. And then, or maybe you have poor brain health because you just partied and ate tacos for 20 years. And then, but there's still potential, when you're ready to commit to your brain health. And it's all about a personalized approach, right? So seeing, okay, what is happening in different areas of health? So is it brain fog, memory, mood? Is it more physical symptoms? And then do they exercise or not? Are they over exercising? Like, where are the areas where we can move the needle? And usually I say there are pillars. So one is, yes, movement, exercise. Then there is metabolic inflammation that we would want to address, whether with diet, supplements, hydration. Then mindfulness for sure. So breath work, meditation, etc. Mood, which might involving someone who is a professional in that area.
Yeah.
And then ocular, motor, vestibular, which means like, how are your eyes moving? How is your balance system working? To make sure you know where you are in space, because especially as you age, your biggest risk is falling.
Yeah.
Right? Falling, like, I'm terrified, like falling, breaking a hip, breaking a wrist. And in the older ages, so let's say 65 plus, women actually sustain more concussions, and it's from falls.
Yeah.
So definitely building your resilience, as whenever you are ready to, it's a good thing to just ensure that all your years of life are as quality filled as possible.
Yeah, absolutely. And do they have to, people who have chronic conditions, is it just like maintaining that healthy lifestyle, or do they have to like see professionals like on a consistent basis?
So usually, like, if someone came to me and said, okay, I feel like reasonably good, but so I always say there's always another level, right? Like, you might feel good, but there's this whole other level that you can gain access to. Maybe there'll be a couple of sessions reasonably close together, like over 2 or 3 weeks, and then kind of go into tune-up mode, essentially. Like, you're given the tools and then you circle back, because often we fall off, right? We need that accountability, and then maybe tweak things as we go. So it's not as intense as like when someone comes to see me with a concussion, I usually want to see them 6 weeks in a row before we start to taper.
Yeah.
So it's a little bit more intensive. But for optimizing brain health, quote unquote, usually it can be like a couple of sessions. And this is actually something that you could do well virtually. I always like the first session to be in person if possible, so I can like actually feel what's going on with the tissue. But then you can monitor virtually, which is cool.
Yeah. Yeah. Really cool. Awesome. And another thing that you kind of have an expertise in, I know you mentioned like hormones and concussion recovery, as well as like sex and gender differences. You want to speak to that a little bit?
Yeah, so like women, we get the short end of the stick a little bit because of our hormones, but I guess we also get some pretty cool abilities because of them. But yeah, so your hormones, actually male hormones can also be disrupted after a concussion. So I'll speak to that. But for women, our periods can get disrupted. You can miss a period, you can get some extra ones, you can lose your period for months. And that, we believe it's because there are little micro injuries that happen to the blood vessels, essentially, that are involved in communicating the hormones between like our pituitary gland and our ovaries. So that gets disrupted, and then our cycle is disrupted, although the ability to conceive does not seem to be affected, which is good. But for those few months while your cycle is getting back on board, that's just going to amplify the symptoms of not feeling well, not feeling like yourself. And also, if you get PMS, it's usually worse as you're recovering from a concussion. Yeah, so there are a number of things there that are related to our menstrual cycle. And then with men, you'll get like a lack of morning erection if the testosterone has dropped, or for them, they'll feel depressed. And if it's prolonged, like weakness and even muscle loss. So it's actually, I mean, of course, they're going to notice a lack of morning erection, but the other things are not as like, who isn't depressed and, just sloshing around.
Yeah,
So, well,
that's
not
hard
that,
to,
but it's like, it's common things that are not specific. And that's the problem, because then people are not as likely to get checked out.
yeah, exactly. Because like you said, like, unfortunately, many people have a past medical history of depression or,
Right?
anxiety, and it's unrelated to concussion. So at least they have that other second marker that they know that if it doesn't
Yes.
happen in the morning,
Yeah.
go to the ER.
Checked out.
It's
No,
an
it's
emergency.
good.
I mean,
Yeah, so it's really complex. What would you call it? Like orchestra that our health is, which is pretty cool, right? And when it's working well, it's great. But when it's not, it needs a little help from your friends, essentially.
yeah, absolutely. Is there any other like final advice you have for anyone who's looking to optimize their brain health as they age? I know I do have a lot of women, which you spoke to hormones, but I know I have a lot of women in my audiences that are like perimenopausal, menopausal, which hormonal changes are coming with that. But just as we age in general, even for the youngins, like, I'm always focused on your longevity, which as an
Yes.
18-year-old, as a 20-year-old, it isn't the focus for them. And, it needs to be, so that you're not doing it 30 years
Yes.
later and wishing that you would have,
Trying to catch
any
up,
advice you have.
right? So one thing, and I'm not an expert in this, but I know, and you probably can speak to this, as women are hitting perimenopause, like the diet habits of the past are not going to work for you. And so like that intermittent fasting is not going to be great. The ketogenic diet I know is not great. And apparently you get to have more carbs. So I've heard. So
Yeah.
what I would say is align yourself with someone who knows more than me around the diet, because it can be, diet is medicine, right? Like what we put into our body. So be empowered to use it that way, use that fuel. But also the type of exercise we do is going to change. So definitely in your 30s, you should be adding in like weights and resistance work. Even if you're someone like me and you just love the cardio, right? Like how we move our body as we age kind of needs to change a little bit. And again, just thinking of prevention, like a strong body is going to be resilient for sure.
Yeah, absolutely. Yeah, it's really interesting about like that diet piece. Because, many people, especially when they're in like the sports world, if they are diving into either the fad diets or the weight cutting diets or even like the keto, and they're doing that, and even if it's working for them now because of those hormone changes, and all of that stuff, sometimes, and those cravings come online, it can just be like a big mess, because there's a lot of like guilt around like
Oh,
having
it's so bad.
cravings, and it's like, I think it's empowering to know that the body actually needs them regardless, like your whole lifespan. So like there's no point in doing those diets now, which is what I preach.
Yes.
A balanced way of eating is always the best. And it's going to set you up for more success, I feel, based off what you've said, when you get older, because you're not going to be adjusting to like a new way of eating, which can cause a little bit of weight gain. It can
Absolutely.
cause like those shifts that most people say that happens during that age, is like, oh, I start to gain weight. And it's like, I wonder if you're just doomed to gain weight, or have you been chronically dieting and now your diet has shifted and your body's metabolism is messed up, and that's why, and because that's been the whole cycle, that's where like the trend is coming from. But it's not an end all be all, as soon as you hit menopause you have to
Exactly.
gain weight.
Yeah, and I'm glad you said that, because I have so many colleagues that focus, they're naturopaths and they focus on that perimenopause stage. And my recommendation would be, when you start noticing some changes happening, align yourself with someone, or at the very least start going online and finding people who work in that area, because you don't need to suffer. Right? Like women, we've been told, oh, you'll lose your memory and get hot flashes and gain weight, and that's it. You're done. You might as well just lock yourself in a dark room for the rest of your life. But actually, you don't have to. There are, yes, a lot of ways we can take action, and take action early to make sure it's as smooth as possible. Yes, so definitely, like, you don't need to be like, quote unquote, I don't want to use the word victim, but you don't have to let your health happen to you, no matter what age you are, right? You just need a little bit of tweaking as you go.
Yeah. And I think it's so important as like a final statement, because we're just kind of speaking to like that tweaking and that adapting. And I think that's the biggest mindset shift people need to have. So many people are stuck in like all or nothing mentality about everything. And if you keep with that mentality, it's detrimental in thousands of ways that I've addressed on this podcast in numerous episodes. But from this perspective too, if you're not open to that adaptation and tweaking, you're just setting yourself up for failure. And I think on the flip side, it actually should feel more liberating to know that you can adjust and make fixes. Like that, to me, when someone gives me that like permission, that feels more liberating to me, to be like, oh, I don't have to keep myself in this box. Oh, I can make these shifts. Oh, that's how my body is supposed to work as we age. And like just making sense of it all versus making it feel like, why don't I fit into this box? And it's like, you're not supposed to.
Absolutely. I love that. It is like, we have choices and we get to decide.
Yes.
Which is amazing.
Yes.
Essentially.
Amazing. Thank you so much for all of this amazing wisdom. And as far as how people can communicate with you, what is the best ways to do that? I'll put it all in the show notes.
Yeah, so definitely via Instagram is the best place to find me and where I'm active the most. And my Instagram handle is concussionrehab.ca. And then when I have new podcast episodes, I do post it there, and it's the Brainiac podcast. But I would say everything goes through my Instagram. So hopefully you have Instagram, as much as I hate to say that, because I want to be off Instagram, but until I'm off, I'm on. And I'd love to have you there.
Yes, go check her out. We'll have everything in the show notes for you to check out, as well as that article. We'll have her Brainiac podcast as well. Again, it goes filtered through her Instagram. So that's going to be the place to go chill, hang out, say hi, shoot her a message, let her know what you learned. You can tag us on Body by Boss LLC as well. We would love to hear any takeaways that you had. And thank you again, Melissa, for spending some time with us and sharing your knowledge.
Pleasure. Amazing. Thanks so much for having me.